I'm going to go ahead and let my panel of fantastic speakers go ahead and introduce themselves, and we'll go ahead and start with Olivia.
Hi, my name is Jasmine Oliver.
Oh, Jasmine, sorry.
It's okay. I'm the founder of Cannabis Science Consultants. I joined the industry back in 2017 doing chemistry, and I realized that the industry lacked greatly in employee safety, quality, and education. So that's the foundations of what I built my business on, to promote that within the industry and try to get us to a better level. Education is really my main focus. A couple years ago with Doane University, I helped them create the first undergraduate accredited hemp courses, which are also available on edX, and almost 20,000 students have taken them so far.
Go ahead, David.
Thanks, Jasmine. My name is David Wunderlich. I'm a senior attorney with the Hoban Law Group. We are a global cannabis business law firm. We have lawyers across the U.S. Covering 30 legal states, as well as South America and the European Union and Israel. We do full-service cannabis business work. I'm the chair of the corporate practice group at Hoban Law Group, and I do lots of mergers and acquisitions, regulatory compliance advice, business transactions, investment, and securities. And I've been practicing law for almost 15 years now.
Thank you.
Good morning. My name is Fenella Kegg, and I am a GMP and compliance consultant. I've been in the industry now for about 4 years. And prior to coming into CBD, I was in the pharmaceutical industry for about 25 years doing pharmaceutical manufacturing. I also have a newsletter called Warning Letter Makeover, where every week I read the warning letters and then break it down into kind of takeaways or educational points to see what the FDA is thinking about.
Hi, I'm Jim Thorburn. I'm an attorney locally here in Denver. I've been practicing in the cannabis space for about 10 years now, and it's mainly tax law. If you've been watching any of the cannabis tax cases that have been going on, you've probably seen my name on most of them. So that's where I came in on this. Now, we do a lot of the other business things too within our practice, and we've got a sub niche within this, and it's doing land use and entitlements for the cannabis space. Of course, that would include CBDs within that. Thank you.
Fantastic. And my name is Liz Geiselman. I am the CEO of Rocky Mountain Regions and 710 Extraction Products. I'm also serving on the board of the National Cannabis Industry Association, where I serve on 2 subcommittees around product safety and manufacturing. I was also part of the CHAMP initiative, which was the Colorado Hemp Advancement Management Plan, where we talked a lot about labeling specifically on the state level. So that's kind of our expertise. So think about your questions as we go through. We're gonna start pretty easy with this one. We're gonna ask the question, where is the FDA right now, and where do you think it's going with regulations? So we'll just go down the panel if that works.
So as you guys know, hemp is federally legal, but cannabis is still regulated. Can you hear me? Okay. More confidently? Okay.
Right on there.
Okay, I'm gonna spit on this. Anyways, so the FDA is really focused on protecting public health, as you guys know. So they're really focused on promoting research and getting more clinical knowledge and what's going on inside our bodies long term, how are children being affected, that kind of thing. So they're really just wanting to get more information. I think the lawyers might be able to answer this one a little bit better.
Absolutely. So from what I've seen, what the FDA is doing is it really is kind of operating within a very narrow lane. The FDA's hands are tied by the legal status of CBD as a drug in the Epidiolex product. Because CBD is a drug in Epidiolex, the FDA is forced to take a position on the existing law that the inclusion of CBD is not permissible in food or dietary supplements. The FDA has taken that position since as early as 2014, and it's been fairly consistent. As Jasmine said, the FDA focuses on consumer safety, so trying to read between the lines or read the tea leaves here, what you see the FDA doing is telling people that CBD is not permissible for inclusion in these products, but they're not really doing any of their more severe enforcement actions, such as injunctions, seizures of products, and that kind of thing. The FDA has focused largely on claims.
I certainly agree with the safety aspect. The FDA is certainly worried about the safety of CBD in the products out there. And I also think it comes down to priorities. I think CBD regulations is a low priority for the FDA. Personally, I'd love to see it come out as a dietary supplement regulation for CBD. So those are my thoughts.
One of the things that I learned as I was going through really the tax issues is figuring out where the government is with regard to cannabis. And of course, this flows into CBDs also, because CBD was part of a Schedule I drug until just recently in the Farm Bill. If you go back 25 years ago, when California and Arizona legalized medical cannabis, Barry McCaffrey, who was the head of the Office of National Drug Control Policy, ONDCP, within the Clinton administration, got a group of agencies together, which included the FDA, but it included Department of Treasury, Nuclear Regulatory Commission, Department of Housing and Urban Development, number of agencies. And the task force that they created was to address how they were going to counter the legalization of marijuana. They wanted to stamp it out. They thought it was unsafe. There was a strategy memo that was created in December of 1996 that laid it all out. And it talked about what the FDA's job was within that, and that they were effectively supposed to regulate it out of existence within it. Now, I don't know if the FDA is following the memo today. If you look at the memo and see how other aspects are addressed, especially with the IRS, you see that the memo has been followed, strategy memo has been followed pretty well. So I think the FDA coming into this space is relatively recent. I will be watching very carefully to see whether or not the FDA is following what the original strategy memo said the FDA was going to do.
I would agree. And I also think that the FDA is kind of watching ASTM to see what's happening in the European Union with what they're going to do, rather than trying to do, double do that work. So it'll be interesting if you're kind of looking at what the FDA is going to look like in this space, whether on either side on cannabis, watching what's going on with the ASTM and the stakeholder meetings and that is probably going to be a pretty good indicator of what happens. I'm going to kind of switch up my questions. So let's talk about how FDA compliance. What does that really mean, right, for this industry? I'm going to ask that question. It wasn't on your panel discussion, but as we're talking about this. So what does compliance mean for a CBD company?
So when it comes to my clients, I always recommend that they have someone in charge of their regulatory affairs. With startups, budgeting is usually pretty tight, so that's not always a possibility, but you do need to have somebody that's dedicated to, researching this. The landscape of cannabis is ever evolving, and it's not going to change anytime soon. There's been incidences where companies did not consult a professional and just built their business a certain way, and then CGMP comes in, or another authoritative body, and says, hey, you need floor drains here, and that's a $20,000 project. So you need to have a plan, you need to have a team, and you need to make sure that you have money in case something like does come up. But in my opinion, if you plan and you hire someone, at least one person dedicated to looking into this and researching, checking the FDA website, staying up to date on all of the news, then I think that's the best way.
So, in keeping with what I said earlier, because CBD is a drug, it's not compliant with food or with dietary supplement regulations, kind of from the get. But nevertheless, if you're making something for people to put into their bodies, the FDA does have jurisdiction over what you're doing, and they're going to want to see compliance with a wide swath of regulations. CGMP, as Jasmine mentioned, is applicable to all of these products. Especially if you're making dietary supplements, as a default, you have to comply with GMP or CGMP standards. That's current good manufacturing practices. And there's, without trying to spell those all out for the audience here, because it would be boring, there are lots of regulations in the Code of Federal Regulations that talk about what you need to do to comply with GMP, whether that's independent testing, preservation of samples, hand washing stations, sanitation requirements, personal protective equipment, to keep hair out of products, whatever it is, it's all in the federal regulations. So as Jasmine said, you have to be thoughtful about how you approach the design of your business, the design of your facility, and your standard operating procedures, because even if your food or your drug or your dietary supplement doesn't fit neatly into a box for FDA purposes, you're still gonna have to comply with all of these requirements. If the FDA comes to inspect your facility, which they have the authority to do, they will find out how you are not compliant, and you might be facing fines or worse, depending on the severity of those issues.
Yes, I'm also a big advocate of having GMP compliance. And, overall, it's pretty daunting, and the regulations are vague at times, and they're hard to interpret. But my advice is to small groups out here, just start small, and you could wrap up your GMPs in about 4 to 6 standard operating procedures. You don't have to have an individual one for everything. And it's just kind of also having a game plan of what your future plans are. You might not be there yet. That is also very important. Having somebody on staff that's your quality personnel is key to implementing quality standards throughout your facility. And, so I'm obviously a big advocate of GMP certification and I think it helps you stand out from the crowd as well, that you have your GMPs in order.
Just echo what it was said, but in a little different context. It said, look at marketing. It says, what happens if the FDA is coming into your business and investigating and finding bad stuff about your business? What would that look like in the press? It wouldn't be good. And regardless if the FDA is able to do this or not able to do it or whatever, they are doing it. And people are going to see it and say, oh, do I really want to buy that product? And so it's beyond regulatory compliance. It's just good marketing sense.
I couldn't agree with you guys anymore. I want to talk about now the possible implications of not being compliant and some of the things that you've seen in the market right now with non-compliant, understanding that the FDA doesn't allow for CBD. That part, David, yes, but what we see from non-compliant products. So what are the possible implications of compliance versus non-compliance, and what are you seeing out there?
So there's a lot of companies that are making claims that they're not allowed to make, like medical claims, for example, on their products. A new one that the FDA has been seeing lately is COVID-19 claims. So like, this CBD product boosts your immune system, and you can't do that. There's no evidence approved by the FDA to say that. And so as they're protecting public health, they're gonna send you a warning letter, and they only give you 15 days, business days, to remedy these issues. So if that's as simple as relabeling your product, it's actually not that simple. But they also go through your website, they go through your Twitter, your Facebook, everything. And that letter will contain all of that, and it's going to lay out all of the issues that you have. And like Liz was saying, you better get an attorney.
So I'm going to jump over to Fen on this question, and then I'm going to come back to our esteemed lawyers for the next one. So would you like to come in on this, Fen?
Sure. Compliance to me is kind of standing out in the crowd, and it tells everyone that you have your act together. So if you're GMP certified, that you are a step ahead of many of the companies out there in this space. And I think it's a good thing to have the compliance, because at some point the FDA will be coming down and saying, you know, CBD will be in this lane, and you will just be ahead of the curve on that. And to touch base, claims are the #1 thing that the FDA has been looking at for the CBD industry. There has been 28 different warning letters for CBD, and the one thing they have all in common are claims. So please, I encourage everybody to clean up their marketing language that they have out there.
And so I'm going to jump to our attorneys now. And so what happens when we get that FDA warning letter?
The real issue, or one of the real issues with getting an FDA warning letter, is that it sends basically a national notice out to the world, or to the country, or anybody who's paying attention, that there is some kind of compliance problem with your product. What that does is it provides kind of a flare gun to plaintiffs' attorneys to come take a look at what you're doing, take a look at your claims, take a look at your products, take a look at consumers of your products, to see if there is a potential piece of litigation that they could bring on a consumer protection action or similar claim against your company, and whether or not that lawsuit would be meritorious or successful. It will certainly cost you a bunch of money to defend it. If you lose, it could cost you a bunch of money to pay a settlement. And given the unsettled nature of these regulations and the space, there's a bit of opportunity for creative interpretation of the regulations that might apply to you. So the kind of the upshot of this messaging is that you keep your head down, keep your nose clean, and don't let the FDA, put a target on your back for aggressive plaintiff attorneys.
Go ahead, Jim.
Just to amplify on what he's saying, if you get that notice, or maybe it's when you get that notice, you should get an attorney who is versed in responding to these notices. I don't claim to be one of those attorneys, but there is a small group of attorneys, locally and nationally in the bar that really specialize in handling it. And it's been attorneys who have been involved typically with the FDA in the past, work for the FDA, and they understand it from the inside out. And I would definitely find someone immediately to help you through the notice. There are all the other side issues that flow from what David was just talking about on that. But you need somebody to guide you through it. This is you're talking about something that could drastically affect your business, could drastically affect you personally too, because they can, depending on what it is, they can go after the person. They don't have to just stop at the business. So take it seriously.
If anybody else would like to jump in on that, please do.
I just want to say that if you do get a warning letter, you have 15 days to respond, which is not a lot of time. So many people will have to go out and get counsel. And so the real key here is don't get a warning letter.
I couldn't agree with that anymore. And I have to say, as somebody who's gone through the auditing process with the FDA, because we are an FDA-regulated facility, that's not a fun thing either. So let's talk about that. What happens if the FDA comes in and audits you? And we can just do round to robin wherever you want to go. So.
Sure, I'll start. If the FDA does come to your facility and they walk in, the first thing you need to try to do is alert everybody in your facility that the FDA is on site. And it really helps if you do some kind of pre-training of how to handle visitors, how to handle inspectors. And the big key takeaway is, don't only answer the question that you were asked. Please do not offer up more information that they have asked of you. And just keep it very professional. First impressions are everything. So I always try to stress to the facilities I work with, first impressions are everything. You have to be FDA inspection ready at all times because you really don't know when they're going to show up.
That goes back to having your plan in place, because when the FDA comes in, they're going to say, where's this paperwork and that paperwork, and you need to have it for them. So you just need to have that team ready. And there's also guidelines on FDA's website on how to handle inspections. I mean, they're not going to give away all the secrets, but there's some tips on there you should look into.
It's important to note that the FDA's inspection does not start when they cross the threshold of your front door. If an FDA inspector comes out to your business to do an inspection, they are likely going to walk the premises first. So you have to run a tight shop, not just in response to an inspection, but just in preparation for an inspection. If an FDA inspector, for example, arrives to do their inspection and walks the premises and sees that your rear egress doors are blocked with crates, or you don't have appropriate surveillance, or whatever it is, you're not even going to know they're there, and you're already starting out behind the 8 ball.
Go ahead.
I think some of the people who are on this panel here are people that can advise you beforehand. Look at your premises. Is it compliant? And go through, make sure that everything is set to go, so when you do get the letter, when you do get the inspection, things will go well.
And I just want to add to that, not only does the inspection start before they come in your door, they've already been on your website, right? So when we're talking about inspectors in particular, they used to have to go door to door. Now they don't. You can have inspectors sitting in cubicles looking at 50, 100 websites a day, and that's what they're doing. And you have to also understand, we're regulated by way too many authorities. If that inspector is having a bad day, you could just be under the gun, right? So you just want to make sure that you understand that. And I agree that you have to have one point person who understands how to talk to an inspector, where the paperwork is, so that they can be Johnny on the spot with that. So let's talk about the FDA versus the FTC.
Well, these are two federal agencies that are charged with different kinds of regulation. The FDA regulates the safety of foods and drugs and supplements and cosmetics. And the FTC regulates the fairness of commerce as it relates to competitive businesses and as it relates to the consumer. We've seen a lot of FDA, FTC, well, maybe not a lot, but we've seen a handful of joint enforcement actions between the FDA and the FTC in the CBD space. In particular, they did a kind of task force to evaluate claims about cannabinoid contents of various products on the marketplace. This was a couple years ago. Testing maybe was not quite as sophisticated then as it is now. And the upshot was that the FDA and the FTC jointly determined that several companies were making false claims about the cannabinoid contents of their products, without speculating whether that was a quality control issue or a marketing aggression issue. What it causes is that you get in the hot water with the FDA for your food and drug practices, and then you also get in the hot water with the FTC for the truth in advertising that you're performing on a national scale. The FTC does not screw around with warning letters. They often go straight to an enforcement action. And so in those cases, what I said earlier about putting a target on your back for a plaintiff's attorney is even more applicable. Making a false claim in advertising is going to hit on the Fair Commerce or Consumer Protection Acts of many different states. So if you're catching heat from the FTC, you've got a lot of problems to deal with. It's better to stem that off in advance if you can.
So most of my work is on FDA warning letters, but I do know both the agencies are kind of marketing language watchdogs. So you do have two organizations that are looking at your content at all time. So that really stresses the fact that everything that you put out there must be clean from drug claims.
I don't think I have anything to add for that.
Okay, no problem. Well, and I just want to say, one of the places that I'm always watching, the FDA has a published list of every warning letter that comes out. So you can look at that at any time. The FTC also does. So when they're talking about FDA giving you a warning letter, the FTC will come down and, like one of my clients got a $75,000 fine. So it happens quickly. Having some of these people on your side is absolutely imperative. And so on that note, let's talk about periodic. First of all, you're starting a new company, how do you kind of work? How do you kind of work with compliance and getting into compliance from the get-go? And then what do we do about periodic reviews of kind of what you're doing?
I'll just briefly say back to what I was saying, have a plan, have a team. One person, at least 2-3 people would be even better. But if you have that plan in place, then you will be ready.
I think that the need for compliance reviews kind of grows incrementally with the growth of a business. It's unlikely for the FDA to, look very closely at a brand new startup who doesn't have a lot of market activity unless that company steps way out of line with the marketing claims, for example. But it is part of your business that you're going to have to build into the growth of your business and account for it as an expense, because the downside of not doing that is too big to tolerate.
Yes, I believe the number one thing you could do is look at your marketing language first and foremost, and then get into looking at what regulation you're going to follow. So there's cosmetics, food, kind of dietary supplements, and then drugs. I like the dietary supplement regulation for CBD. The big difference between food and dietary supplements for the regulations is a batch record. So for dietary supplements, you must have a batch record for every lot that you're producing. So I think those things are very important to have, and have a plan and chip away at it, and just start with baby steps and understand that they are there, and at some point you're going to have to follow them.
Remember too, this is a new industry, and agencies, this is general with agencies, this just isn't with the FDA or FTC, is that they're looking at a new industry. They want to find out more about the industry. You might be targeted within that because they're trying to learn what this is about. So something that might not catch their eye in another industry, it's going to catch their eye in this industry for nothing else that it's new. So you got to be careful. Everything that they're saying here, it can be magnified because of the nature of the industry.
And I would say if you're starting with a new brand, make sure you're using a consultant that really can get you to that GMP level. Make sure that they're reviewing your marketing materials. Again, when we're talking about your real estate, it's not just the physical place that you exist. It's also everything that you have online that mentions your product, everything on your website, testimonials, everything is your property. That's your real estate. They're going to be looking at all of that when they come in, right? So having a compliance person kind of helping you through that to set that up, or if you currently have a business, keeping them, bringing them in and having them review. But I think it's imperative that you have an attorney. First of all, you know where to get that guy's phone number when the FDA inspector comes in, right? But also that you're doing periodic reviews, especially if you're moving product across state lines or doing it in different states. California is a very different market than Colorado, and Indiana is a very different market from Colorado, right? So if you're looking to try and have a compliant product, especially something that you want to take on a national level with branding, you're going to want these people in your court and have them at the ready. So I think it's really important because Colorado's laws are changing. If you follow that, especially on the marijuana side, California is almost always changing, right? I mean, that's what California does. So I'm going to go ahead. We've got about 15 more minutes. We can keep talking, but why don't we see if you guys have any questions? Anybody?
Why I personally? Well, it's either going to be, in my mind, I believe the FDA is going to regulate it as a dietary supplement because it does fit all those definitions. But with a dietary supplement, you have to have all your GMPs in place. You also have to have your food safety plans in place. And then also if you're importing your foreign supplier verification program, a lot of companies are getting hit on that. I do want to stress one more thing, that as a brand owner, let's say you're buying CBD tincture as a white label product, you are still 100% responsible for your GMP compliance. Just because even if you're using a contract manufacturer that has its GMP certification, the responsibility still comes down to the person whose name is on the label on the bottle. So just be aware of that.
If I might jump in to answer that question, the question was, why is it more likely for the FDA, or why do we prefer dietary supplements, or why does Len prefer dietary supplements over foods or cosmetics as far as a CBD product is concerned? There is a regulatory reason why it might be slightly more likely for the FDA to approve a dietary supplement use for CBD rather than a food. The FDA currently hasn't taken any positions one way or the other about CBD and cosmetics, and that really means that people have been operating kind of freely in the cosmetic space with CBD as an ingredient. But when it comes to ingestible products, there's a significant difference between foods and dietary supplements. When you are putting something new into a food, you are required to have something approved in advance as a food. It has to be generally regarded as safe, and GRAS is a pretty strong bar. You need to collect significant data, submit it to the FDA. You can self-certify whether something is GRAS or not, but the FDA does have to rule on whether they approve your certification. You need to do that in advance. With dietary supplements, it's not a new food ingredient. It's called a new dietary ingredient. The approval process happens in arrears. The FDA has not approved any dietary supplements in arrears containing CBD, but there is a pathway in the Food, Drug, and Cosmetics Act for the FDA to take CBD out of the category of a drug and approve it as a dietary supplement by making a rule and going through the public notice process. It remains to be seen whether the FDA is going to do that or whether Congress is going to step in and force their hand one way or the other. But there's just a slightly more tolerant attitude from the regulations concerning dietary supplements as there is concerning food.
Do we have any other questions? So I just want to also touch on another thing, because obviously Delta 8 and Delta 10 and all those things are a big subjects around here, right? The FDA actually has a section within their regulations for synthesized molecules. So chemically synthesized molecules has its own section under the FDA. If you are taking CBD and putting it and making it a Delta 8, it potentially could fall under that category. So be aware of that regulation too. Because if it falls into that category, because you don't know if your vitamin C is naturally derived or synthetically derived when it's in your orange juice, that's why they have that category. So if they put it into that category, we're talking about a whole nother thing. So just be aware of that's there. Anybody?
Just to tie on to that statement, if you are taking a minor cannabinoid and putting it into an ingestible product, it's still subject to all the FDA requirements that CBD would be, or that echinacea would be. It's a dietary ingredient. The fact that it's new or is derived from cannabis does not save you from the regulations.
I just wanted to add one thing about white labeling. I think it's really important to understand that testing right now in the industry for cannabis is not standardized. So if other industries do have their methodology for testing, published, but cannabis, that's considered proprietary. So you can send the same exact sample to 10 different labs and get 10 different answers. So it's really important to find a lab that is working with the standards they're required to work towards. There's often times when you will send the same exact batch out to a lab and you'll get 3 different answers or whatever, and that's because in the industry there's up to a 15% variance. So if you buy 100% pure CBD isolate, it could actually be 85%. And unfortunately, that's just where we are right now. So I don't know what the FDA's exact methodology is for testing, but it's probably different than the labs that we're using, or there's so many different methodologies out there for this. So just keep that in mind. never just accept a COA if you're buying a bulk ingredient. Get it tested. Obviously, ask for it too. You need to know what it says, what they're saying it says, but get it tested immediately and compare and make sure that it's at least close, and use a different lab than they did.
Well, and on that subject matter, I mean, especially when all of this was kind of new in Colorado, we saw so many fraudulent C of A's, right? So that's the other piece of this. Make sure you're working with a lab that's actually credible and all the things, and the lots match and all of that. I know that we're going to have another panel in a little bit on claims and descriptions. Does anybody else have another question? Please. I didn't quite hear that. I'm sorry. Yeah, so if your company, I think the question is that your company is staged here in Colorado, but you want to run a national brand. So do you have to hit our regulations, or which regulations should you pay attention to? Great question, because we have 50 states, and 50 states are making different rules about every damn thing, right? So I think it's probably best to follow California because they are the most stringent, but they're also kind of the most ridiculous. So I don't know how else to say that. But I know Colorado has a very comprehensive on that CHAMP initiative. If you haven't looked that up, it was put out by Governor Polis. There were over 500 stakeholders in this space talking about everything you could possibly think about with hemp. They have a marketing piece, they have a labeling piece, they have testing, everything kind of exists in this. And it was accumulated by I think it was CSU who put that together. And it was a 2-year project. So they're trying to make that what the FDA is gonna do or what USDA is gonna do. So that's why they kind of did that initiative. So I would look at that and make sure you're keeping an eye on what's going on in that space. But go ahead and I'll let some of you guys offer an opinion on that as well.
Were you talking about your brand name? Was that what you're referring to, or more just the? Mm-hmm. Okay, well, if you're talking about the brand, and so this is why I was getting into the name, I was just wondering, is that you get into trademark issues, and if somebody, like, you probably couldn't come in, like if you were in Florida or whatever, and you decided to come into Colorado and you wanted to call it Green Solution, for example, you probably would have some trademark problems with the name. So if you're going nationally, you would want to make sure whatever name you're using is going to be available in all the jurisdictions that you're planning to go into. You don't want to pick a name that is going to be deceptively similar to a name that's in a location that you're going to want to go into.
But if your product is on a shelf in Colorado and CDPHE comes in and takes that product and tests it to our regs, yes, you're on the hook for that, right?
Right. Yeah. Yeah,
Absolutely.
definitely the state regulations, I mean, for the product itself and all that. But I was referring just to the name question, the name of the brand.
I'm going to go to David because.
Yeah, I think I might have heard some additional piece of that question. The question that I heard was, if you are starting a new brand, can you start it anywhere in the country, or do you have to pick a state where it's legal? And I think that the answer is you need to pay attention to the state-by-state regulations for the product that you want to make. So just, to pick a couple states, for example, Utah requires product registrations if you're making a CBD product in Utah. Kentucky does not allow you to make chewable, snuff hemp, like in the form of chewing tobacco. There's various regulations about what you can and can't do across the country. If you're able to make it, in the state where you're domiciled, shipping it out across the country under the auspices of the Farm Bill is probably going to be fine. but you do need to do that analysis before you spend a bunch of money to start a new facility.
That is 100% correct.
I've done this work and it's a huge project. I had a rolling project, it was probably 30 hours every time we did it. And that's going as fast as possible using work that we already did. If you're starting from scratch, you've got to go to the primary sources for each state, which is statute, administrative rules, Department of Public Health, news about law enforcement activity. There's a lot of information. Okay.
And I can tell you that it's also always evolving and changing. I think California changes every month. Colorado, we have a working group that changes those laws as they seem fit, right? But it's not scheduled on a quarterly basis or annual basis. It's basically when an inspector goes in, finds a product and goes, oh, this was an unintended consequence. Now we have to write a rule to prevent this from happening, right? And so that rulemaking is happening all the time, and if it's happening that much here in California, it's happening in every state that way. I'll let you guys give any final thoughts if you'd like. Nope, okay. I'll dance for a second. Well, I just want to thank our panelists and thank you guys for being here. If you do have any questions, I'm sure they'll be around for a little bit, but I would definitely, if this is a space you want to be in, watch those FDA letters. I think that's the big takeaway. Keep track of that website. Look at the FTC. Look at what they're fining people for. Because in these warning letters and in these FTC fines, they tell you exactly what they're looking at. And I think you need to have counsel, and I think you need to have a regulatory person at your disposal to keep you where you need to be. I think those are the big takeaways. Anyone else?
There's still a lot of opportunity. You just have to be thoughtful about how you pursue it.
Go ahead, Jasmine. Did you have something else?
I think that the companies that are paying attention to these things and getting ahead of the curve are the ones that are really going to be the long-lasting companies that are here in 20 years. I think the companies that are just cutting corners and trying to save money where they shouldn't be, unfortunately, we've seen them fall in the past years, and I think that trend will continue. So get ahead of the game, do what's right, protect public health.
Either of you?
Yep. I think a compliance foundation is the key to any kind of organization in this space. So start early, start now, and just, you might not be there 100%, but at least you'll have a plan and a roadmap to where you want to be.
Compliance and really business organization along these lines is not simple. It's complex, and you might be starting out at a small level on that. You're not going to start out as one of the large cannabis companies. You might not going to be Canopy or Columbia Care or something like that, or along those lines. But you still have. There's all these things that it's kind of like a big checklist of items that you got to check the box and make sure that you've done, because you could have the alphabet soup of regulators coming in, whether it's state or federal, and shutting you down, fining you, or worse. So you just need to take care of business.
All right, well, thank you all. You're all fantastic. Can't wait to work with all of you. If you guys have any other questions, feel free to talk to them as you're walking out. There's also, like I said, at 12:15, there's going to be a claims and descriptions. And that's where we're really going to get in the nitty gritty about what you can and cannot say. So if you're around for that, I'll be on that panel as well. Thanks, guys.
Thanks, Liz.